Good morning, I'm Milimo1, a student at Copperbelt University pursuing Masters in Public Health. My thesis presentation is understanding the causes, the factors associated with teenage pregnancies in selected parts of ZIMBA districts in southern province of Zambia, and also understanding the causes. This is indeed a qualitative study. So, teenage pregnancy remains a significant public health problem in the rural Zambia, and particularly in ZIMBA district, which is found in southern province. So, this study it actually explores key factors contributing to teenage pregnancies in selected communities in ZIMBA district, using a qualitative approach with data collected from 90 respondents, including teenage mothers, parents, healthcare providers, teachers, community leaders. This study identifies social, cultural, economic, and systemic drivers to teenage pregnancy. So the findings indicate poverty, lack of comprehensive sexual education, peer pressure, cultural practices that are being practiced, and limited access to reproductive health care services are the most prominent factors. So the study also includes recommendations for policy intervention, education reform, and community mobilization, that is to reduce teenage pregnancy and support adolescent girls. So the keywords that have been used in my thesis is teenage pregnancy, which is a cardinal one. We have qualitative study, adolescent health, specifically rural Zambia, where we are picking on ZIMBA district, and also socioeconomic factors and reproductive health. So teenage pregnancy, we are actually saying that this is a pregnancy that is occurring in girls aged 13 to 19 years. It is a major issue and indeed of public health importance that is affecting this group and more to the rural district as depicted in Zambia, ZIMBA district. So there are major issues that are affecting the public health. Teenage pregnancy affects education and socio-economic development in Zambia. In rural districts such as ZIMBA districts, we see that the prevalence of teenage pregnancy has been alarmingly high. In Zambia demographic survey of 2018 notes that nearly 30% of adolescents, girls in southern province, have experienced pregnancy before the age of 19. So this study will actually aim to investigate what are the underlying causes of teenage pregnancy, specifically in ZIMBA districts of Zambia. And it will also analyze what is the impact of this teenage pregnancy and recommend the context-specific solutions in relation to the teenage pregnancies. So the objectives of this study is actually to explore social, cultural, and traditional factors that are contributing to teenage pregnancy in ZIMBA districts, to identify the economic and educational influence that increase teenage pregnancy, teenage pregnancy risk, and also assess the role of family structure, peer pressure, and media in shaping adolescent and sexual behavior. And lastly, to explore how access, which is lack thereof, to reproductive health services affects teenage pregnancies. So the main methodology of this study is going to be the study design. Of course, it's a qualitative research design, as will be used to gain an in-depth understanding of lived experiences and perspectives of community members. So the study, of course, we use a semi-structured interview as well as focus group discussion. So in terms of the study setting, the research will be conducted in selected communities of ZIMBA district, which is found in southern province, and the area, as we say, ZIMBA is predominantly rural. It has limited infrastructure, widespread poverty, and indeed strong adherence to traditional custom. So the sampling that will be done and participants, so we're going to do a purposeful sampling. That's the sampling method we're going to use, and of course 90 participants will be selected from this, of which disaggregated by 40 will be teenage mothers, which are 13 to 19 years, Then we'll have 20 parents and guardians. We'll have 10 teachers, and we're going to have 10 health care providers, as well as 10 community health workers. So in terms of the data collection too, that are going to be used, we are going to use indeed a semi-structured interview guide. We'll make use of the focus group discussions guides, auto recorders. Of course, this will be done with consent from the participants. So data collection process, interviews and focus group discussion will be concluded. Will be done both in English and local, as we say that this is a rural community, so that we can really get the actual information, and interviews explores the individual